This is episode 38 with Dr. Heather Paulson. Welcome to My Kid Cures Cancer. I'm Ryan Sternagel, childhood cancer navigator and health advocate. Each week we'll talk to a new expert on healing cancer or human optimization to bring you one step closer on your path to preventing or reversing cancer and attaining true health. Thanks for spending some time with us today. Now let's dive into this life-saving information you're not going to hear about in the hospital. Just what do you take to protect yourself from conventional cancer treatment? We are about to find out from Dr. Heather Paulson, who is a board-certified naturopathic oncologist, providing the highest degree in expert care in using natural therapies to support people who have been diagnosed with cancer. For people currently going through cancer treatment, Dr. Paulson can help reduce fatigue, nausea, weight loss, weight gain, sleeplessness, constipation, diarrhea, provide immune system support, reduce neuropathy, and help with red and white blood cell normalization. Dr. Paulson also provides recommendations that are specific to your cancer diagnosis and your unique medical history and environmental exposure. For those interested in using herbs, nutrient, diet, and lifestyle changes safely and effectively, Dr. Paulson will be an excellent guide in this path. And an interview like this, I believe, is way overdue, and I promise you that there are a lot more like it on its way. While I love talking about all the ways the body can heal itself of cancer when we give it what it needs, at the end of the day, this is a show for people going through cancer. And a lot of you going through cancer right now are going through some form of conventional treatment for one reason or another. Childhood cancer being a very notable one of those reasons, of course, in our minds. And we want you to have all the information you can to make the best of that experience as well while you're going through it. We've of course touched on natural therapies, interactions with conventional treatment in other episodes, but we haven't devoted one just to this topic until now with our friend Dr. Heather Paulson, where we covered the waterfront of ways to protect yourself and your healthy cells and tissues from the damage that can come from conventional treatment. Some of the things we specifically got into were the safest supplements to use in combination with chemotherapy and what Dr. Paulson uses almost across the board, regardless of chemotype. And on the flip side, I also quizzed her on a whole bunch of different types of chemotherapy, and she let us know what the biggest damage area of concern is for each and how to best protect it. We talked about radiation, what to put on your skin and what to be cautious about, and also mitigation of radiation toxicity and protection from brain damage, some of the things she has her patients on after conventional treatment is over, and also some contraindications of things you'll want to be very wary about if you're considering taking them alongside your conventional treatment. As always, we're glad to see you here at My Kid Cures Cancer, where it is our goal to bring all sides of the discussion on how to heal cancer and be truly healthy to the same table to give you one place to tune into for the most well-rounded perspective possible. This is a show for people going through cancer, by people going through cancer, inspired by my wife Teddy and I's experience with childhood cancer, bringing our son Ryder back from a stage 4 cancer diagnosis to the happy, healthy little boy he is today. If you aren't dealing with cancer in your family and want to keep it that way, the show is probably going to be a very valuable resource to you as well. We'll get to Heather in just a minute, but before we do, I do need to let you know that the information you hear on this show is for informational purposes only, very good informational purposes at that, and is not intended to be a substitute for medical advice, diagnosis, or treatment. And just in case you thought something changed in season 2 of this podcast, I did want to let you know that we still love our sunlight and sauna. It's still been an intricate part of our cancer to health journey, and you can still get $150 off one of your own when you let them know that you heard about it right here on My Kid Cures Cancer. And if you are listening to this podcast and have not subscribed on iTunes or Stitcher, or you're watching this video and haven't subscribed on YouTube, do yourself a favor and take care of that right now. I like to think we put out a whole lot of very helpful information when it comes to those interested in a holistic approach to cancer reversal and prevention. That's enough out of me. Let's get to this interview with Dr. Heather Paulson. Welcome back, everyone, to My Kid Cures Cancer. We have with us Dr. Heather Paulson. Heather, how are you? And thanks for coming on.
I'm doing great. Thanks, Ryan, for having me here today.
Yeah, this is really neat to finally get you on. I think we first met at I always forget the order of the OnCamp, what it actually stands for, Oncology Association of Naturopathic Professionals, practitioners, physicians.
Yes, you got it.
Yeah. So we first met back then. That was my, I guess not my first cancer conference in general, but certainly, I don't think anybody goes to that thing that isn't a naturopathic oncologist doctor besides me and Scott, the guy that writes some articles for My Kid Cures Cancer every once in a while. So that was really neat, getting to be in a whole room full of you folks and getting to hear how you think and all that stuff. It was pretty cool.
Yeah, it's always good to meet each other in person. Online is a great way to connect with each other. And I'm sure those of you listening and watching, you've connected with some really great people online, but nothing is the same as like a face-to-face contact. So it's been really cool to see you and Teddy and get to know you guys over this past year.
Yeah. Yeah, it's good stuff. Well, that being said, we I guess kind of let the cat out of the bag as far as who you are and what you do. But that being said, do you want to just give everyone a little briefing of your how you came about to be a naturopathic oncologist? Is that something you were always called to do? It seems like you probably weren't in third grade dreaming of being a naturopathic oncologist, but
No.
and then also, if you want to go over the difference, and I think some people, prefer naturopath. Is the correct pronunciation naturopath,
It's
or is it?
whatever you choose.
Yeah.
And really, it's kind of a dividing line. I think it's one of those things where it doesn't really matter.
Okay.
Naturopath. As long as you're working with somebody who's licensed in your state or is licensable, that's a real distinguishing factor. I did my residency at a hospital, an integrative cancer center in Indiana that was part of a general hospital. And in that state, we weren't licensed as naturopathic doctors. And so there were a lot of people there, and there still is not licensing in Indiana. So there's a lot of people there calling themselves naturopathic doctors or doctorate of naturopathic medicine who went to some online training schools and things like that. So that's an important distinction. But whether you say naturopath or naturopath, I don't care.
And that being, I definitely want to get into your history, but now before I forget, do you have any advice for people living in states that are pretty much outlaw or whatever you want to call it, sanctioned naturopathic medicine? Even, I mean, one, just for finding just a good general naturopathic doctor to work with, but then also, especially if you're going through cancer, what do you do if you don't have a licensed naturopathic oncologist doctor? There's a difference between, like you just said, a naturopath and a naturopathic doctor, and then a naturopathic oncologist doctor who specializes in oncology in particular. But yeah, I don't know. What do you usually tell folks that you talk to that don't live in a state like that?
Yeah, there's a lot of naturopathic oncologists that will work with people from a distance. There's some that do just consultations over the phone or over a video chat session like this. And I do that with some of my clients that live out of state. And you'll notice that I call them my clients and not my patients, because I'm not allowed to establish a doctor-patient relationship with somebody who lives outside of my state and outside of my scope of my license. However, I do have some patients that travel to Arizona to establish a doctor-patient relationship, and then we can continue our conversations when they get back home. But there's a couple of us that do that, and you can check us out at the oncanp.org. So that's oncanp.org, and that has a list of all of the naturopathic oncologists in North America. In North America, there's only I think there's less than 100 board certified naturopathic oncologists. So the chances of you having one in your backyard, unless you live in Arizona or Oregon, Washington, the chances of you having someone nearby that specializes in naturopathic oncology is very, very slim. And in order for us to be board certified, we have to prove to a board of our peers that review our cases that we're safe and that we're effective and that we're utilizing therapies in a way that a board of our peers would recommend. And then we take like a 3 to 5 hour multiple choice exam on literally I have a stack of research papers that's bigger than this screen that I could show that I had to read through and memorize the outcomes of in order to become board certified.
Sounds like I want to be working with a board certified naturopathic oncologist. So I always point people to oncamp.org, and then that's, about 50-50 because a lot of people do live in the bigger states that have, plenty of them there, but then a lot of people live in the more spread out or just prohibitive states that don't. What percentage of, board certified naturopathic oncologists would you say do kind of the remote consultation angle as well, like you do?
I think it's a very small percentage because it's such a gray area legally. I only know of a couple of other naturopaths that do that and naturopathic oncologists that do that. And in fact, some of my colleagues that feel a little nervous about that, they refer to me because they know that I am supporting people in a consultant role, not in a physician role, as they are in different states and don't have access to naturopathic oncology.
Yeah, very good. It's tough, but there's a few out there for sure. All right, now backing up.
Backing up to who the heck am I?
Yeah, who the heck is this person talking so knowledgeably about naturopathic oncology?
Yeah, so I did not grow up wanting to be a doctor. In fact, it was never something that, my parents looking at me as a little kid did not think I would go to medical school. I had my sights on becoming a marine biologist, and I did that. It's actually really cool. I went to undergrad for aquatic biology at UC Santa Barbara, and I worked for the Department of Fish and Game doing fisheries management, and I worked for the National Park Service in Muir Woods doing salmon habitat restoration. And the crazy thing is that life puts you on a certain path and you just keep following the road. I know you totally understand what I'm talking about, Ryan.
Oh, yeah.
And you probably didn't dream of hosting My Kid Cures Cancer either. that was in your future.
A website and podcast called My Kid Cures Cancer. Yeah, I didn't see that one coming.
Yeah. So what happened is, like for you guys, cancer put a little stop in my road and made me choose a different path. When I was working for the Park Service, my dad was going through colon cancer treatment, and he had been diagnosed with colon cancer 4 years previously and had been kind of going through the cycle of cancer being, him being cured and then it coming back, and him being cured and it coming back. And when I was working for the Park Service in Muir Woods, which is these giant redwood forests in Northern California, which is just a phenomenal place if you haven't been there. My dad was actually dying of colon cancer, and he died while I was working for the Park Service. And I went home and was home for almost 2 months, kind of taking care of my dad while he was in his dying process, and also after he died, tying up all the loose ends of that. So those of you listening who know what that's like, you can understand that was a very trying time for me. I was like 22 years old, 22 years old at the time. And I was just looking around going, okay, now what am I going to do with my life? And I was actually not verbally communicating with my dad anymore. He was at a point where he was really quiet and still. And I was still kind of like, what am I going to do? What am I going to do when I go back to the Park Service? What am I going to do with my life when my dad passes? How am I going to make an impact in the world? And is saving coho salmon the biggest impact that I can make? I think salmon's important in oncology, but there was other things that I could do. So that's when I went to my aunt's house that night and started continuing to research things. Because once you are of a research mind, and those of you listening, you are of a research mind, like you like learning more stuff, it's hard to switch it off, even in that kind of dying process. So I was still looking for answers. And when I went to my aunt's house, I came across this word, naturopathic doctor. And I was like, what is a naturopathic doctor? Are these guys quacks? Are these for real? What is this profession? And I looked into it a little bit that night, and just had this like voice in my head say, you're going to go to medical school. This is what you're going to do with your life. And I was like, no, I'm not. Like, I pass out when I see blood. If you vomit, I vomit with you. Like, I'm not going to medical school. I got sent home from school because a girl in front of me had a really big booger and I puked on the bus. Like, I was not designed for becoming a doctor from that standpoint. But from the standpoint of wanting to help people who had been diagnosed with cancer, people who had been asking the same questions that my dad was asking of his oncologist. He was always asking, like, should I be eating something different? Is there anything else I could be taking right now? Are there things I could do to help lessen my side effects? And his oncologist would always kind of brush those questions off and say, no, continue eating what you're eating. Really, the cancer's in my colon. You don't think I should change my diet? No, just keep eating what you're eating. Make sure you maintain your weight. The first time he met with a dietitian was when he was on TPN, which is when your food is coming through a bag into your vein, when he was on hospice care. And that really made me sad and also fired me up a little bit. So with all of these kind of experiences rolled together and coming across naturopathic medicine, I went back up to Northern California, back to the Redwood Forest, and started applying for school and took it from there. It's still like a windy road of exactly how I got there, but I won't bore you guys. But that's basically how I showed up at naturopathic school, knowing that I wanted to specialize in cancer care from day one.
That's yeah, I hate to say pretty cool, but it's Lord works in mysterious ways is the only thing I can really, say about my journey or yours or anybody that ends up where they are doing anything really.
Yeah, absolutely. And it's why my center is called the Paulson Center. I named it after my dad. I wasn't trying to put my own name like on a wall or anything, but I wanted to do something in honor of him. And I really do look at every day that I work with people as a way of honoring his memory and stepping into somebody else's life, trying to ease some of the pain that we all experience through cancer.
That's yeah, that's really neat. And yeah, just what you mentioned about the first time he saw a nutritionist did you say he was on a tube?
Yeah, it was on TPN, so it was an IV of a
Okay.
bag of
Yeah,
nutrition.
I got you.
Yeah.
Yeah, we had to like fight because we wanted, it was a 1-year-old child for us, and we wanted to get a feeding tube into him immediately, like before any chemotherapy or prescription, anything went into him. And that was like a big, it was a fight, really. Just, that they argued that, like, why do you want a feeding tube in now? He still looks good. And we're like, well, we want to keep him looking good.
Yeah, you guys have fought a lot, and it's been amazing to see what comes when you have a really great advocate. As a patient advocate, you guys are advocating for so many people now, and it's important to, when you have cancer or you're supporting somebody with cancer, I think it's really important to build that team around you. And if you don't have someone in your family, hire someone who's going to fight for you and advocate for you, or get your family members and friends on board. It's so important. You can't do it by yourself.
Yeah. Yeah. It's just, there's too many resources out there, like, online, and it's not like you're just limited to the people or the doctor in your area these days, like we're talking about. And if you look hard enough, you'll you'll bring the people in that need to be in. I'm glad you made that point.
Mm-hmm.
All right, well, like I was just telling you before the call, I don't think we've done just a deep dive into kind of supporting a patient or a client or someone going through cancer the best possible way in terms of being side by side with conventional treatment, chemotherapy and the radiation. So, and I know that's, what you're doing all day, every day, like you said. So I'm really excited for this, and I think it's going to be really helpful to a lot of people. I thought we could just kind of break it up into kind of protecting, increasing efficacy, and then any actual contraindications. If you just want to start at maybe protection and maybe just specific to chemotherapy, I don't know if I know there's different things you can do for different chemos. If you want to get into any of that, or just kind of high level how you think about it or how you approach it, or I'm sure I've said enough, and you can probably take it from there.
Yeah, so I'll start with a high level, and then I might, if you want to throw out some chemo, you can just like pop quiz me with some chemotherapies that you get common questions about, and I'll be like, oh, well, we do this, this, and this for that chemo. So one of the things that I'm really excited about talking about this particular topic is because I see so often that it seems like you have to choose between natural therapies or conventional oncology. And it's important to recognize that there's actually this whole big area in between those two extremes that really deserves to be looked at, and really is where most people with cancer would thrive and survive the best, when they're using the best of both worlds. So I really recommend taking a look at that if you're leaning one way or the other, and seeing if there are ways to meet in the middle. And that's just a big part of my job in helping my patients figure out where that middle ground is. So with that in mind, our most important thing is to make sure that we're not using natural therapies that are going to decrease how effective the drugs are or the radiation is. I always tell my patients that if you're going to go through that, you want to make sure it works, right? You don't want to repeat it over and over again. And we don't want to impede it from working the best way that it can. The other thing that you want to look at is how the drugs and the nutrients and the herbs or any other supplements that you're taking are metabolized. So we're talking about how is your liver taking in these substances and utilizing them and getting them out into the body or out through bowel movements. How's everything moving through your cells and through your body? And I think this metabolism of nutritional supplements is the real reason why a lot of oncologists will say, don't take anything. Just don't take anything. I'm scared of you taking anything. Just don't take anything. Because they just don't want it to interfere with the mechanism of action of the drug. So that just means how they don't want it to interfere with how the drug works and how it's being metabolized. So those are the things that we look at. And with some of the newer drugs on the market, like some of the immunotherapies, it's really kind of a challenge because the researchers don't even know the exact mechanism of action or how it's being metabolized or what the body exactly is doing with it. So we take our best information that we have based on other drugs and try to apply it to some of the new drugs on the market. But that's one of the challenges of using natural therapies alongside chemo and radiation, is knowing how they're going to play well together. Are they going to play well together? Or are they going to not? So that's my main job, is taking a look at all of the medications people are on and going through and saying, okay, this is safe, that's not safe, this is safe, and looking through their trunk full of supplements that they wheel in with them and kind of categorizing them as safe with the medication and unsafe with the medication. And we do that for radiation too. So I'll talk about chemo first, and then I can kind of talk about radiation, just because they're a little bit different in terms of some of the things that we use. But that's like the lay of the land of what we do as naturopathic oncologists and how I support my patients. Some of the things that are the safest to use with chemotherapy are generally amino acids. So a lot of times when I'm working with a drug that I'm not really sure how it's being metabolized or what's going on with the drug, I feel safest using amino acids as a supplemental protocol. Amino acids are just proteins. They're just the building blocks to proteins, and they don't tend to interfere with drug mechanisms of action or how the drug is metabolized. And for the most part, it supports the body in creating ATP or making more energy, and it supports the mucosal membrane so that you're not getting mouth sores or leaky gut issues, diarrhea, constipation, and it can help the liver get rid of toxins better as well. So that's probably like if I were to say that there's one category of things that people could generally use as something being safe, it would be amino acids. And then exactly as I'm saying that, I'm like, except this amino acid and that amino acid. And so it's just really hard to generalize because it's on your, like, we do things based on your specific drug, your specific cancer type, and what's going to support you as an individual the best.
Yeah. Yeah. No, and that's why you want to work with somebody for sure. And it's definitely, especially I'd say, always work with somebody because nobody's going to know, or you're not going to know as much as somebody else at any time just jumping into this, but especially going through treatment. Yeah, it's important. So that being, I mean, are there any kind of generalized supplements or even just protocols or procedures, like any kind of like mild detoxification or keeping the pathways clear or something like that like, across the board would be protective or side effect mitigating, managing that you tend to fall back on there?
Yeah, so in terms of the amino acids that are generally safe for everybody, the main one that I lean on a lot is L-glutamine, just because it does help with phase 2 detoxification in the liver. So that phase 2 detoxification is when the bad stuff is actually getting out of your body. So it can support that. And then it also helps with, like I was saying, the mouth sores, any GI upset, and it can help reduce any muscle wasting that happens with chemo. So it's something that I use specifically while people are on chemotherapy, though, because I can just hear somebody who's listening to this being on the other side saying, but glutamine causes cancer growth. And I totally hear you. I hear you saying that. And there are some studies that show that glutamine can potentially be something that cancer cells can grow and live off of. And that might be why there's cachexia or muscle wasting with cancer. But it's either the cancer cells get it from your muscles or they get it exogenously. And there's been study after study after study showing that using L-glutamine with chemotherapy or with radiation doesn't cause cancer cells to grow. They go away, and it helps with remission. So from a perspective of using it integratively with conventional treatments, I think L-glutamine is safe, but we try to limit how long we use it for.
Yeah, it's, to my understanding, it's almost like a backup fuel in a sense for, cancer in the absence of glucose. It can still use glutamine, but then, like you said, glutamine's so abundant in the body that even if you're doing some kind of hardcore ketogenic thing where you're restricting all glucose, I don't think they have it really figured out for how you would get the glutamine that's already in your body away from the cancer cells anyway. So yeah, no, that's kind of where I've landed on it as well, is just, it does seem to work really well, right around chemo. So that's, I think that's probably most important, is just, getting through it, and not getting wrecked. Anything else that's kind of across the board for you?
I use a lot of L-carnitine as well, which is another amino acid that's used for making ATP or energy. And I find that very supportive for most people. It's great for protecting the kidneys. So some of the chemotherapies that tend to attack the healthy kidney cells, it can be great for protecting that. And L-carnitine, in some studies, in some chemotherapy instances, can help reduce neuropathy, and in other chemos, it might increase neuropathy. So it's not a straight across the board. And then the other thing that L-carnitine is great for is protecting the heart. And there's a lot of, especially in kids, when we're talking about chemotherapies used in pediatrics, there's a lot of drugs that can make the heart get larger or not beat as effectively. So the L-carnitine has been shown to help protect against that particular side effect.
All right. Should I throw a few specific ones at you, or do you have any others that are kind of just, you
Okay,
know?
pop quiz time. Rock and roll. Yeah, sure. Yeah, throw some stuff at me. I'm happy to take my best shot.
Yeah, and I don't, like you said, I mean, there's some chemos that get used more for children than adults, and those are the ones I'm familiar with, and I don't, yeah, so I don't know. We'll see.
Yeah,
How
I
about
did a rotation in pediatric oncology as part of my residency, so
oh, that's cool.
We'll just go back a couple years.
About cisplatin.
So cisplatin, some of the things that I like to use with the platins in general, so cisplatin, oxaliplatin, carboplatin, I kind of, in my mind, I lump them together, even though they're slightly different, but the platins as a group behave pretty similarly. So with the platins, I definitely would use L-carnitine to help protect the kidneys, because the kidneys are at risk when you're on a platin-based drug. And we also use, the standard drink plenty of water, try to get fluids in, which is a little bit harder when you're talking about a little person. You can't shove water down them that well, although you can use
feeding
syringes.
tubes.
I've seen you feeding tubes. Yeah. So water is important, but L-carnitine can help with that. There's some studies in children looking at the neurotoxicity of the platins with, like I said, in pediatrics, particularly with hearing changes or ringing in the ears, and vitamin E seems to be helpful for reversing that, according to the research. So those are some of the things that I look at is what does the research say about this particular drug, and what natural therapies has been looked at to interact with this drug in a positive way. And vitamin E also protects the kidneys from the platins. And then something super simple that protects the kidneys from the platin-based drugs is calcium and magnesium. So that's pretty easy to get. And you can, if your child has a hard time taking supplements, I just have my parents soak them in an Epsom salt bath for the magnesium sulfate. And that is transdermally is a great way to get magnesium in. So those are some of the things that come to mind for the platin family.
Awesome. Yeah, you could do like a topical magnesium spray as well. We like that, as long as there's some that itch worse than others, but yeah. How about doxorubicin?
So doxorubicin is one of the ones that I was talking about that has risks for changing how the heart functions, and so I really focus on that with doxorubicin. So L-carnitine, like I talked about before, that can be protective. CoQ10 can be protective and help the heart muscle function really well. And those are the main things that I focus on right off the bat. And then most kids have different kind of side effect profile that pops up down the road with doxorubicin. So I wait to see how each individual responds to chemo and what their side effect profile is going to be, and then we kind of go in and patch things up.
Yeah. No, you can start geeking out based on the individual side effect, which we actually have a few pretty good articles. I'd be interested to hear your take on them actually at mykidcurescancer.com. Scott Chiveri, who you met at OnCamp, wrote a few good articles. I'm pretty excited about having him up there. Cyclophosphamide?
So cyclophosphamide or Cytoxan is another one that can affect the kidneys, and so we keep an eye on that. And the side effect profile for most of my patients is pretty low on that particular drug. So it's more management. Some people get headaches with that drug, and sometimes that can be relieved with magnesium or a good homeopathic remedy. But for the most part, that doesn't cause as many new concerns that we haven't talked about already. It can impact kidney health and function. So the same things that I said for the platin drugs apply to cyclophosphamide.
All right. Fair enough. And maybe we'll do one more, and I'll this is riveting.
Kind of a fun game.
I hear about Vincristine a lot. Maybe we'll end on that one.
Yeah, so vincristine and vinblastine I lump together a little bit too, just like with the platins. And that one is pretty harsh from what I see side effect profile wise. So I'm glad you brought that up. There's a lot of studies on how to prevent any fibrosis in the lungs or scar tissue in the lungs building up. And there's a couple of natural things that have been looked at for that. One being L-carnosine, which is an amino acid, not L-carnitine, carnosine, so Osine. That's been studied. Vitamin E has been studied. There's been some things on ginseng and vincristine and vinblastine. And then the neuropathy. I mean, I've had some kids on those medications who stop walking because the peripheral neuropathy gets challenging for them, which is always kind of a bummer to see. But I've had some success with helping that out with some vitamin E. I have an acupuncturist that's in my office, and we both volunteered for a local nonprofit organization that supports kids with cancer here in Arizona called the Head Foundation. And he has some really good stories with acupuncture for the neuropathy as well. And he just does little ear seeds with the kids. So so they don't have to like sit still with acupuncture needles in them. And
Sorry,
sorry, can you hear me?
Yeah, no, I can hear you. I was going to say you just barely glitched when you said the name of that foundation. I wanted to make sure to get it in.
Oh, it's called the Melonhead Foundation. So it's an organization here in Arizona, and their main goal is to support parents with helping them pay their bills, actually, because as your child is diagnosed with cancer, a lot of times one or both of you have to take an absence from work, and so they look at themselves as a gap service where they can help pay your electric bill or your gas bill, or get you gas for your car. And for a little bit, they had a wellness center where there was a couple of us who are integratively minded that were helping kids through their treatments.
Oh wow. Well, that's and are they a local, like they serve the local area sort of thing?
Yeah, they serve locally here in Arizona, and they did have some people that they were supporting that were out of state as well.
Okay. You heard it here if you're in Arizona. All right. How about radiation? That's probably an entirely different ball of wax, or at least, yeah.
It really is, because with radiation, what we're looking at is how to protect the tissue that's around the area that's being radiated without blocking the radiation from working. And one of the things that's kind of controversial in a radiation oncology suite, which might not seem that controversial, is should you put anything on topically or not? Like how do you protect the skin, and how is protecting the skin going to impact the radiation? And it might seem really silly, and it did seem kind of silly to me as I first started my residency and started talking with the radiation oncologist, like, why does it matter so much? And what one of the radiation oncologists kind of explained it to me in his physics terms, but I'm going to explain it to you guys in non-physics terms. So I grew up in Southern California, and my sister liked to tan, which we all know is like a total no-no anymore. And I hope her skin recovers from that teenage tanning. But when they tanned, they would put oil on top of their skin, like a coconut oil, a tanning oil. And that's because when you put that oil on top of your skin, the UV radiation from the sun actually gets trapped in those upper layers of the skin and causes your skin to change color, to tan easier. So that's the concern with putting things on top of your skin during radiation. The concern is that you might be doing something that's nourishing to those top layers of the epidermis, those top layers of your skin and the fat pad that's under there. But the question then becomes, what is it doing to how the radiation beams are reflecting into the body? How are you impacting the light waves? So that's where a lot of radiation oncology centers get a little concerned if you put thicker oils on top of the skin before or after radiation, or anything that's not water soluble. So that's where we get creative and we say, okay, well, if we can't use these creams that would be potentially helpful, what can we do that's water soluble? And in my office, I recommend a calendula tea, which is calendula petals made in a big stew pot. You brew it like you brew a tea, and you strain the petals off, and then you can use that water as a topical application. Sometimes we'll add green tea. That's been studied for reducing radiation-induced dermatitis as well as the calendula. And then there's been studies on wheatgrass, like taking wheatgrass and putting it on the skin, and that's water soluble. But I've never really convinced a patient to paint wheatgrass on themselves. So we stick to the calendula and the green tea. But if any of you guys are adventurous and want to use some wheatgrass, that, according to the research studies, is also effective.
I think you'll find a few adventurous folks listening to this show for sure.
Yeah, that's why I threw it out there, just in case.
Yeah.
Keep it interesting.
Yeah, no, we tend to attract the most hardcore of the hardcore around here. So no, it's, anything you got, throw it out for sure. So is there any other topical things that you do? And then second part to the question would be just any, like, I don't know, general internal radiation poisoning mitigation type stuff that you take into account?
Yeah. So those are the main topicals that I work with. And because they're so effective, I generally don't have to dig deeper than calendula extract.
Nice.
So that, yeah, it's awesome because it works over and over and over again. In terms of protecting the cells from radiation, there's some controversy about using antioxidants alongside radiation. So the main damaging effect of radiation to our healthy cells is, one, the damage that it causes locally to wherever the radiation beams are being directed to. So number one is I always look at where is the radiation happening and how do I support the local tissue. If it's happening in the chest area, how do I support the lung tissue? If it's happening in the abdomen, how do I support the GI tissue? If it's happening in the pelvis, how do I support the bladder and the pelvic tissue? So depending on where the radiation is happening, or in the brain, I guess with pediatrics a lot too, how do we support the healthy brain tissue or help those nervous system sheaths regenerate themselves after radiation? So those are the kind of things that I'm always keeping in mind. And then in general, we do sometimes recommend doing high antioxidants on the weekends. So helping, because most people don't get radiation on the weekends. Radiation seems to be a Monday through Friday kind of therapy. And so on those 2 days off, we just have our patients amp up their antioxidants in their supplements and in their diet to help replete those stores, because it is actually one of the proposed mechanisms of how radiation works is by creating this oxidative stress in the body. So we want to make sure it has enough substrate to actually generate the stress that it needs to generate.
Yeah, no, it's well, I guess I might as well ask you now about antioxidants and chemotherapy, just from I wanted to get to that in the contraindications, but as long as we're on antioxidants, yeah, what's your take on antioxidants, chemotherapy?
Yeah, so what's funny is that I use the term antioxidants, and I teach oncology at the Southwest College of Naturopathic Medicine, and I have the word antioxidants is like completely banned from our vocabulary on that shift, because what is an antioxidant and who categorizes it as an antioxidant? It's kind of crazy, because what I hear from my conventional oncology colleagues is that antioxidants are strictly contraindicated. However, CoQ10 could be protective and can protect the heart with doxorubicin. Well, is CoQ10 an antioxidant? Maybe. Melatonin is a huge antioxidant for our body. It's termed an antioxidant, and yet we see over and over again that the research shows that high doses of melatonin protect the bone marrow, reduce the side effects of our bone marrow not making enough red blood cells and white blood cells, and can actually improve survival rates. So the term antioxidant is really troublesome to me because it lumps all of these things together, and it's not very discerning. It's not really thinking about the individual or the medication, the drug, the treatment that they're undergoing. So there's no way to say that antioxidants are indicated or contraindicated for any particular disease process or drug therapy or to reduce side effects. It's impossible to say without getting down to the nitty gritty. Now, when I was talking about antioxidants for radiation, I'm thinking more of like berry extracts and eating foods that are rich in bioflavonoids and maybe adding some vitamin C on the weekends, things like that, that help replenish that oxidative store so that radiation could potentially work better.
Sure. Yeah, no, it's antioxidant. It's like the term carbohydrate.
Right.
You're talking about a
Good carbs,
potato
bad
or
carbs.
refined sugar or something. Yeah.
Yeah, right.
Um, on the radiation note, so is there any, I don't know, just overall systemic, like, obviously you'd want to be doing a bunch of detoxification just in general after you're done with treatment on everything, heavy metals, chemicals, radiation, all that stuff. But like when you're in the thick of it, I don't know, anything else you do?
When I'm in the thick of it, nope, it's really focusing on supporting the tissues. And we know that radiation can cause long term side effects to bone health, to heart health, to lung health, brain health. I mean, there's so depending on where the radiation beams are pointed towards. So it really depends on what kind of radiation we're talking about. But for example, for brain radiation, I love to make sure that people are on a high fat diet and also eating a lot of fats supplementally. So taking high levels of fish oils and things of that nature, because I've seen that be helpful for helping the brain regenerate itself post radiation and reducing some of the maybe walking changes that happen with brain radiation or speech or any changes that of dysfunction that happen with that. So taking fatty acids can be really important for protecting fatty tissues. So there's other fatty tissues around where radiation is happening. That's something that I would definitely recommend. But I don't say like, I mean, I've read on some other websites and stuff that you should be taking iodine because that protects against radiation or things like that. But iodine has its own downsides. And so particularly with kids, it's not something that I would blanket recommend. But as an adult who's also being exposed to radiation, if your kid is going through a radioactive process and then you're holding them before and afterwards, you might be exposed to radiation. It would be good to probably increase your own bioflavonoids and making sure that you're taking some things that protect your cellular health at the same time.
So now you got me curious. What are the downsides of iodine that you're thinking of?
Well, the main downsides of iodine is that for some people it can trigger an autoimmune reaction and then it can block the absorption of certain nutrients. So if you take high doses of iodine when they're not needed by your body, then it can cause some downstream effects.
All right.
So it's like a case by case basis.
As with most things. All right, and then I guess now that I've said that, anything in particular, like after radiation is done that you're trying to work on?
Yeah, so after radiation is done is really when we focus on doing some IV vitamin C. Again, kind of squelching any free radicals that are still in the body and helping the system recover from radiation. And even low dose vitamin C can be really helpful with that. Low dose versus high dose, it depends on who's defining it, what we're talking about there. But so after radiation, I tend to do about 12 grams of ascorbic acid of vitamin C in an IV just to help the body recover from the oxidative damage from radiation.
12 grams. So is that is that kind of like a recovery high dose, or is that your like even, straight up cancer high dose of
Yeah, when they're talking about high dose for
and
pre,
adult versus children? I'm just asking
yeah,
because 12 grams was when we were, in the middle of cancer going through chemotherapy. That's what, that's what Ryder, my 1-year-old son at the time, his high dose was 12 and a half grams.
yeah. So I'm saying that based on adult weight. So for kiddos, we do it based on their body mass, on their weight. So it's like so many grams per pound that we would consider high dose or low dose. In adults, 12 grams would be considered kind of a low to moderate dose of vitamin C. And then when we're talking in adults about using IV vitamin C as something that could potentially block cancer cell growth, we're generally referring to 50 grams of ascorbic acid and above.
Very good. Yes.
Yeah. Don't make
Talk
me
about
do math,
the
so like for off the top of my head for kids dose.
Yeah, no, of course, not asking you to be prescriptive by any means, but at the same time, let's talk about a common question is, what exactly is a high dose of vitamin C? Yeah.
Yeah, so you can basically take the adult dose and half it or quarter it, depending on the age of your child, would be a general guideline, not based on specific weight and mass. Not something I would recommend a physician do to calculate the child dose, but as a parent, if you're trying to figure that out, that's how you can look at it.
Yep. Yeah. All right. Anything on like, potentially increasing efficacy of either chemo or radiation that, that we haven't already covered on the protective end of things?
Yeah. So increasing efficacy, that is super drug specific, and a lot less information on that. A lot of the studies are just looking at making sure we're not interfering with how well things work. But when I think about increasing efficacy, that's when I step away from the drug or the radiation a little bit and look at the actual tumor type and say, okay, what do we know from the research studies that's natural that actually blocks this tumor type from growing, and take a individualized approach from there. And then I have to go back and say, okay, these are the things that we know block this tumor type. But are any of these things contraindicated with the drugs or with the radiation? So I have to just kind of double check myself there and cross back over.
Nice. Yeah, okay. Yeah. So you're just kind of taking it by what compound might have an effect on the cancer, and then let's make sure it's not, contraindicated. And yeah. And just for anyone listening that, again, please work with somebody, but there's a lot of research. You can take one of those blog posts that has like 100 different supplements in it, or when someone gets on one of the Facebook groups and is like, I've just been diagnosed with cancer. What do I do? And there's like 80 different people that all list off 5 different things, and you got 400 different, potential plants that you could use. You can go into PubMed with that big long list, and then start, searching against your individual cancer type, and you'll get a lot more results for some things than others. And that's, that was our, kind of my guidepost and my research with just neuroblastoma in general was, that's what I did.
Yeah, using PubMed as a resource, if you can utilize that, that's fantastic, and it's my go-to resource as well.
Very good. Very good. And then anything we haven't touched on as far as, more contraindications that you would like folks to be aware of?
Yeah, well, there's a lot of things that are more contraindicated in adults that it's a little different for kids. But in general, we take caution with some things that seem really simple, like B vitamins, B complex, just because some of the B vitamins might actually be protective to cancer cells. But it's a little unique in kids because one of the things that we try to restrict in adults is folate. But with kids, after their treatment, they're going to continue to grow. We want to support their growth, and sometimes I'm even doing things to help stimulate growth factors in them so that they can have good musculoskeletal structure. And so folate is not restricted after treatment in kids the way it is in adults, but it can be during treatment unless your oncologist is prescribing folate with the methotrexate or something like that. That's not contraindicated. So B vitamins in general and the folate. The other thing that I see sometimes in combination products is arginine. And L-arginine actually increases the blood vessel formation in our muscles and in our periphery. And that can also help cancer cells grow blood vessels. So sometimes arginine, I've seen a couple people recently coming in with a beet powder. I don't know if it was talked about on a documentary or on somebody's website or something, but there's a lot of people coming in with a processed beet powder, and it's very high in arginine. So I just would caution you against taking high levels of arginine because of that blood vessel stimulation that can happen. But that doesn't mean beets are bad. Like, beets as a food should be fine. It's just that's how I'm seeing it sneak into my patient's supplement bag right now.
Huh. Now I'm curious where all the beet rage came from.
Me too. I'm like, what blog did you read? I want to go post a comment. Eat beets. Eat whole beets. This is better.
That's funny. So like, would beet juice in your mind be something to be wary of then?
So not so much when we're talking about whole foods and eating it from a food source. I'm not as concerned. But they're actually adding arginine to the beet powder. So our arginine is naturally an amino acid that's naturally a little bit higher in beets in general. And then there's some studies that showed that with runners and with bodybuilders that they had improved muscle recovery when they were eating beets, and that makes sense. They tore their muscles and they need to repair them, and the blood vessels help repair those torn muscles. And with cancer, we're also trying to keep our muscle mass around and repair what's going on from the treatments in terms of exhausting our body, but it's a little bit of a different mechanism.
Yeah, for sure. All right. Well, I got my, two questions I ask everyone that comes on at the end, but before I do, just anything in particular that, but out of everything we've covered that we haven't covered that you think would be helpful for folks, and no worries if not, but I just want to make sure I'm not cutting you off with something on the tip of your tongue.
Yeah, no, I think I kind of hammered that it is so individualized. And sometimes when I first entered naturopathic medicine, I'm like, that's the cheesiest cop-out response ever. Why aren't you just giving the information that we need? But it really is individualized. And there's so much that's unique about every cancer cell. We're learning so much about how, even like, I was just watching TV the other night and they were saying, oh yeah, we've learned that we used to lump this one type of brain cancer as just one type, and there's actually 3 different types within this one type. And so it is important to understand, like, on a molecular level, everybody is unique. And you mentioned, Ryan, that those of you watching or listening might not know that much about the uniqueness of every single cell, but what you guys do know is the uniqueness of your own body or the uniqueness of your child, and that is precious information, and that gives you the power to really advocate for your loved one and making sure that they get the best care that's possible. So don't forget the stuff that you do know and how important that is.
Awesome. That's a very good thing to keep in mind. Thank you for thank you for pointing that out, because it can get overwhelming. But at the end of the day, I think folks have more power within them than they really realize, for sure. All right. Well, Heather, I guess I'll get to the last questions. If you had to boil everything you knew down into 3 golden rules, and those rules would be on how to stay healthy and disease-free or become healthy and disease-free, whatever you needed, what would those be?
Oh, That is a really great question. And I'm going to request to expand it to 5
Oh my.
instead of 3. But it's easy to remember. So I actually have an ebook on my website called The Great Life. And GREAT is actually an acronym for the 5 things that I think, based on all of the research that I've read, what I see in my office, and what I read in cancer care, the 5 things that you need in order to stay healthy. So the G is to get active. So exercising 10 to 30 minutes a day or 170 minutes per week. So getting active is important. Reducing your risk of cancer or risk of recurrence by looking at biomarkers, gene pool, what you're coming into the world with, and treating your uniqueness is also important. Vitamin D. So reducing your risk. Eating a healthy diet is the E, so eat for life, making sure you're eating a plant-based diet with some healthy sources of animal protein if that's what you like. And then, so GREA is to add meaning into your life. So there's so many studies on forgiveness, on meditation, on prayer, all of these things, volunteerism, all these things that add meaning to our life actually can help reduce risk of recurrence. And then to think green, so that's the T in GREAT. Thinking green is looking at all of the toxic chemicals in your home, in your environment, and making sure that you're doing your best job to reduce your exposure to those toxins, and then supporting your body in eliminating toxins as often as needed.
That's a good list. That's a good list. Yeah, and I definitely like the thinking green at the end. And I think it gets overlooked even kind of in the natural health circles. But are you living in a home that's kind of harming you, or are you living in a home that's not harming you and could even be healing you if you're set it up right. That's why we have our on our website our little healthy home checklist that we we think it's that big of a deal. I spent a long time putting that thing together. So yeah, that's good. And then, excuse me, lastly, you already kind of had one great final thought, but if you have anything else come to mind, just if you have any kind of, just final thought or sentiment for anyone going through cancer, excuse me, right now that you'd like to take us out with, that'd be awesome.
Oh, my final thought. So if I think back to myself prior to naturopathic oncology and going through the process with my dad, and later actually becoming part of my husband's process when he was diagnosed, my first year of medical school, he was diagnosed with lymphoma. And so that was another learning experience for us. And so I will leave you with a piece of advice from my husband, who is a lymphoma young adult cancer survivor. He was 25 when he was diagnosed. And his advice to me was to be his partner and not his doctor, even though I was in medical school. And I know that you listening, you've put so much energy and effort into learning as much as you can about cancer and advocating for yourself or a loved one. And it was like, at first I was kind of like, what do you mean you don't want me to be your doctor? Like, I am in this with you. I want to learn about this. But when he wanted me to be there for him, by his side, as a partner, as a loved one, as someone he could turn to like share his emotions with and have along the journey, it took me a couple of days to process what he was asking of me. He was asking me to be present with him and not have my nose stuck in a bunch of research studies and quoting to him statistics and stuff. So I think that was a really important piece of our relationship and going through the experience together, is as much as possible, be present. Like I said, create that team. So then I had to hire out people that I felt like were adequate for taking care of my precious resource, my husband, and making sure that they were keeping eyes on him so that I could relax and just be present with him.
Awesome. That's a really good thought. Really good piece of advice. I know that this whole interview is going to be really helpful to a whole lot of people. I really appreciate it, Heather. Do you want to let everyone know where they can find all things Heather Paulson?
Yes, so it's pretty easy to track me down everywhere. I'm Dr. Heather Paulson. So I'm Dr. Heather Paulson on Facebook, on Instagram. My website is drheatherpaulson.com, paulson.com. So that's where you guys can get a hold of me, and I am just grateful to be a part of your community and look forward to getting to know you all better.
Awesome. Thanks, Heather. Yeah, you have a good one.
Thanks, you too.
Like I said, this is definitely a very important topic for a whole lot of you watching and listening, and not one that I want to neglect for so many of you that really need to know this stuff, so stay tuned for a lot more like it. As always, the interview highlight article and our thoughts on how the information applies to childhood cancer, along with all resources mentioned and how to download the audio or watch the video, can all be found at mykidcurescancer.com/Heather-Paulson. And also, as always, if you're getting a lot out of this show, if you feel like it's really helping you, I would ask you to consider helping us keep it going by literally kicking in any amount of money you wish per month, because alongside everyone else who is doing just that, it really helps make what we're doing here possible, and we're so grateful to those of you who already do just that. I really hope you know that it means the world to us. Lord willing, we will see you next week with the Juice Lady, Sherry Calbon, where we'll be talking about all things juicing and cancer. Music was provided by TheFatRat and the Tasty Network, and all editing was done by the lovely Teddy Sternagel. If you are going through cancer, you know what time it is. It's time to just keep going. This is Ryan Sternagel signing out for now. God bless and Godspeed.